people feel that people with mental illness do not improve. But when I compare it with other illnesses, whether it's neurology or internal medicine, we do see a significant difference in improvement. And when you see that changing, you can feel the difference. When you see a schizophrenic who probably was in and out of the hospital for the last 5 years, and suddenly his or her symptoms are in control now and can go back and work in some capacity outside, that is significant. I usually explain to medical students and families to make them understand why this happened, and because there's always a concern that could we have prevented this? And they always raise that question, would it be prevented? Because frequently you hear that, my son was fine, my daughter was fine until she was 18, 19, she did high school, he did high school, and then he joined the Marine Corps. And then in the boot camp over there, I don't know what they did with him, and now he's schizophrenic. My usual answer is not, they didn't do anything to him. It's almost, I give an analogy, so it's a very crude analogy, but it makes them understand it. It's like your water heater in your basement. It has a pilot on all the time, whether you need the water or not. And when a child is born who might have a risk factor for schizophrenia, that pilot is on at birth. It doesn't show any symptom, the water is not warm yet. It waits for the trigger to happen. You have to be very careful how you label somebody with that diagnosis, because as far as I'm concerned, there is no rush to make the diagnosis. Because if somebody has a psychotic symptoms, it can be treated with medicines and the diagnosis can wait, because the treatment is not affected by what diagnosis you give. Because schizophrenia is not a common illness. It's only 1% of the population in the world is affected. In very simple ways, schizophrenia is a chronic illness. It's not an acute short-term illness. We're talking about illness which, once you make a diagnosis, and if you're correct on that, it does not go away. So it's just like high blood pressure, hypertension, and diabetes mellitus. This illness is a chronic illness. We don't have a cure for it. That's why an ongoing treatment is needed. Ongoing medicine is needed. You need to ongoing tweak the medicines around depending on the circumstances and make sure the symptoms are in control, just like you would do for diabetes.